Haemophilia is a medical condition in which the ability of the blood to clot is severely reduced, causing the sufferer to bleed profusely from even a slight injury. On the occasion of World Haemophilia Day, which falls in the month of April, Medicircle is conducting an exclusive series featuring eminent hematologists to spread awareness about this rare medical condition. Hi, this is Amrita Priya, and you are watching Medicircle. Today, we have Dr. Punit Jain in our show. Dr. Punit Jain is an experienced hematology and bone marrow transplant physician with a demonstrated history of working in the hospital and healthcare industry. He has completed his specialty training in clinical hematology and bone marrow transplant from the Christian Medical College, Vellore. He has also undergone advanced training in management of leukemias and hematological malignancies from MD Anderson Cancer Center, USA. He is currently associated with Apollo Hospitals, Navi Mumbai. Hi, Dr. Punit Jain. Welcome to Medicircle.
Hi, Amrita. Thanks a lot for inviting me, and thanks for inviting on a very special day. It's important for people to know the word hemophilia, and we have a dedicated day, World Hemophilia Day. So yes. I'm going to try and make people aware about this condition as much as possible and to the best of my abilities.
Okay, so Dr. Jain, to begin with, what causes hemophilia?
Okay, so that's a good question. Basically, hemophilia is a spectrum of a lot of bleeding disorders, a tendency where a normal human being starts to bleed profusely, uncontrollably, and sometimes even fatally. So it's a disease which is a sex-linked disease wherein a female can become a carrier. They may not manifest, but a man can have that gene and become a patient. He could have mild hemophilia, moderate hemophilia, and severe hemophilia, depending on the amount of protein that is there. That protein is required for normal clotting in the blood. And imagine a situation where that protein is not there in your body. So any cut you get or any injury you get, you will tend to profuse bleedly, and that can happen repeatedly in your life. And that can cause a lot of problems.
Okay. And what should a person do if he's is suffering from hemophilia?
So most important is the right diagnosis. Normally, these patients who are diagnosed as, especially the severe hemophilia, they are diagnosed very early in life because, very small children, they start to bleed, prolonged bleeding in the teeth or small cut, and they've had some surgery and they bleed profusely. So when you're diagnosed, you need to consult a hematologist and ask your physician or your pediatrician who they can guide you better. But you need a proper hematology team handling you if you're diagnosed with hemophilia. Now, we are a long way from complete cure. Complete cure is through gene therapy, yes, but it's coming, but it's going to take some time. But there are treatments available in terms of prophylaxis, replacement of those proteins, what we call as factors. So hemophilia A, we replace factor 8. Hemophilia B, we replace factor 9. We keep replacing. Those are very costly drugs, but it is available to control one event.
Okay. And so it is a manageable condition only, or it can be completely cured?
So in current scenario, it is a manageable situation, provided you have a good treating team, good nurses, good society. That is a hemophilia society. If you're a part, you're well connected, there is availability of factors. So there are a lot of factors. So it is manageable. Patients with hemophilia can undergo major surgeries under a good supervision and a good team.
Okay. But cure, is it like curable 100%? Like if someone is...
So It's in the current scenario. If we talk about our country, it is not curable.
Okay.
You need the gene therapy, replacing the entire gene to completely cure it. We are as a country far away from that. It's coming. There are institutes who are doing trials, but as of now, I can say it is manageable. An event of a bleeding is manageable in the right environment.
Okay. So if one gets diagnosed with this condition, then it's a manageable disease. But the only thing is that cure is still on its way. Like it will take some more time so that in a country.
It's going to take some time, yes, but it's manageable. You need to stay connected and keep meeting your doctors.
All right. So thank you so much, Dr. Punit Jain, for your insights on hemophilia, because this is a very rare condition and people do not really know about it. I think in our country, not many people suffer from it as well.
Yes, it's probably there in 1 in 10 to 15,000 patients. So it's really rare.
Yes, and doctors also treating it are rare, I think, in especially.
Yes, hematology is a rare breed. You can always contact me at my email address, Dr. Punit Jain at hematcare.in. I'm available at Apollo, but I have my clinic in Powai, Hematcare, and you're most welcome to consult.
Okay, so thank you so much for your insights, and thanks a lot for being part of the Medicircle show on hemophilia.